Hi guys, my name is Mackenzie Herman. I'll be doing a 21 Days to a Happier You. So if you want to join me on this journey, you're going to be learning a lot of stuff, but you may ask what the 21 Days to a Happier You entails. And so I will tell you, we are going to be discussing pelvic health, which is kind of a not a topic that's talked about a lot. And so I'm working with Katie Noonan, who is a local physical therapist here who treats pelvic health, and I'm trying to help promote her practice because she believes, and I believe, that this is a topic that more people could use and more people can learn about so that they know that their problem can be fixed. So you may or may not know what pelvic health is, but I want to start first with just talking about what the pelvic floor is and what the functions are for it. So the pelvic floor in itself is a hammock of muscles suspended between the front of your pelvis, which is the pelvic bone, and the back of your pelvis, which is the sacrum. And both women and men have a urethra and a rectum. Women have an additional opening called the vagina, which is important for sexual intercourse and childbirth. Some of the different functions of the pelvic floor include holding our bladder and bowel movements so that we can decide when to use the bathroom. It supports pelvic organs and it controls sexual function, as well as it stabilizes the low back, hips, and pelvic girdle. So you may be like, why are we learning about this? Because there are so many different things that can go wrong, so many different dysfunctions that can help it happen within the pelvic floor. But all of those things can be treated and hopefully get better with therapy. But you may wonder what pelvic rehab is. So I'll kind of give you a little overview of what would be done with Katie. And later on, I'm going to bring Katie Noonan in and have a question and answer with her, which I think is going to be really beneficial for you guys because you may have had these questions and don't know who to ask or how to ask. And so I'm going to bring an expert in and she's going to give us some good intel for that too. So pelvic rehab, it's a non-surgical approach to rehabilitation of dysfunctions in the pelvis that contribute to bowel, bladder, sexual health, and pain complaints. So different approaches for this may include behavioral strategies, manual therapies, modalities, therapeutic exercises, and education, as well as functional retraining. So what types of things do you treat, or does Katie treat in pelvic rehab or pelvic floor therapy? Well, some of those things are for women. A lot of them are, but there's also a lot that are for men as well. I'll go through a couple of things that she treats. So some of those include prenatal care, which are, of course, for our women, pain management, leakage or intimacy concerns, constipation, and prep for labor and delivery. So for those soon-to-be moms or those who are thinking about getting pregnant, if they have any of these problems, they come talk to Katie and they can talk to her before pregnancy or after pregnancy, which is really cool. She also treats postpartum care, which includes addressing the diastasis recti, pain-free intimacy, scar management, pelvic, back, and breast pain, guided return to exercise, so how to exercise after delivering a baby, and then also core and pelvic floor strengthening. So another one is pelvic organ dysfunction, which can be for our men and for our women. So those types of things include leakage, urgency, frequency, cancer, constipation, hemorrhoids, and endometriosis. The next one is pain management, which can, like I said, it's very broad. There's a lot of things that can fall under this, but pain with the spine, sacroiliac, pelvic girdle, or even the coccyx. And then the last one is sexual dysfunction, so pain during or after sex, and erectile dysfunction, along with many other things. So for these 21 days, we'll be talking about some things about core exercises, Kegels, like I said, question and answers with Katie. I have a yoga plan for prenatal and postpartum, which is also really cool. I have a pregnancy HIIT workout, as well as just a lot of informational videos. So if you decide to take this journey with us, you're going to be filled with lots of information. But I don't want you guys to be overwhelmed. I want this to be fun. I want this to be informational, and I want you guys to learn something from this. So if you do, you can go down the website that I have, and you can contact me through email, or you can contact Katie. I think I linked her email on there. She also has an Instagram page, which is awesome. Gives you little short videos, kind of like what I'll be doing. But I'm just really excited, and I hope that these 21 days make you feel better, make you feel that you've learned something, that you've gotten something from this, and I hope it helps you to reach out as well, because pelvic floor therapy can help. And if you guys have these problems, it's not normal, and it can be fixed. So we're really excited for you to take this journey, and I'll see you guys in the next video.